And welcome to the webinar this morning, where we're going to talk about our community health profiles in Birmingham, and in particular this morning looking at the sight loss community health profile. So my name's Tessa Lindfield. I'm an Assistant Director of Public Health in the Public Health team in Birmingham, and I'm joined by my colleagues from the communities team this morning. You'll meet some of them as we go through the webinar. So let's move on to the next slide and get cracking, shall we? So I've got a bit of housekeeping to start off with. We'll ask that people can keep their microphones off just to keep the background noise down. And if anybody's having difficulty with bandwidth, we found that if you turn off your VPNs, then that can sometimes help. If you've got any questions, please feel free to put them in the chat. The idea is we're going to produce an FAQ if we don't get to answer them in the meeting today. So we're really pleased if you could pop your questions into the chat. And we're recording the webinar today, and that recording, audio and visual, will be available on the online platform on the website, along with the community health profiles themselves and the other products that go with them. So if you miss a bit of today, you can always go back and listen again. Let's move on. So we're also going to be using Menti this morning, which is an app that helps us do some interactive work online. So if you don't have Menti downloaded on your phone already, you've got a chance to scan the QR code or just search for it in your app store, download Menti, and then you need to enter the code there, 5698 6071, which I'm just busy writing down so I can do it myself. And we'll be using that later on. But before we start the actual session, we'd really like to play a short video from our cabinet member, Councillor Mariam Khan, to welcome everybody this morning.
Hello everyone, I'm Councillor Mariam Khan, the Cabinet Member for Health and Social Care. I'm delighted to see the launch of our community health profiles and so pleased to be welcoming you all. I am proud of how diverse Birmingham is and of how welcoming we are to people who choose to make this city their home. However, we know that not all of us experience the same levels of good health and well-being as each other, and that there are real differences between communities. In the Council, we take this seriously and see tackling these unfair differences in health as a core component of the work that we do. The community health profiles have identified and summarised the physical health, mental health, lifestyle, behavioural and wider determinants of health-related issues affecting communities both locally and nationally. The findings from these key public health documents will shape how we address, protect and prevent health inequalities in our city. We've always struggled with understanding the detail of some of these inequalities, and this is where our community health profiles come in. The Public Health Communities team have, in partnership, developed a series of evidence summaries that focus on helping improve our collective understanding of our diverse communities, the health and well-being challenges and key inequalities that they face. I hope that you find this session useful. We have the opportunity today to share our approach and findings with you and also to discuss this in more detail. And afterwards, we'll look towards how we can work together, not only for our respective communities, but for Birmingham as a whole. Thank you.
Great to hear from Councillor Khan then. And I'm seeing lots of people join as that video was playing. So if people want to introduce themselves, can you just pop your name and your job title, maybe the organisation that you're representing today, into the chat, and then we'll know who we're talking to and who else is on the call. Would be really helpful. Okay, let's move on to the next slide. Okay, so the community health profiles are part of a programme of evidence reports that we've been producing here in the public health team. And part of the role of public health is to describe the health of the population, but also the inequalities between different communities within our population. And the idea is that we we produce the facts, that we produce information that helps decision makers who are designing programs and interventions to address those health needs and also the health inequalities between different communities across Birmingham. So some of these evidence reports we have to do by law. So there are some statutory reports, such as the Joint Strategic Needs Assessment and the Annual Director of Public Health report, which Justin Varney produces every year, and the Council has a duty to publish. So you'll see the purpose of those on the slide there, about summarising the health and wellbeing inequalities and using data wherever it's available that's reliable to produce those reports. If we move on to the next slide. And we also, as well as the statutory reports that we're required to produce, have some additional reports that we're choosing to supplement the programme. So we have a series of deep dive needs assessments, which are very structured needs assessments into a specific area, and that make recommendations for action around the need of a population. And we also have some topic-based commissions, which is an evidence collation, so using active community collaboration to build evidence-based solutions for particular challenges that Birmingham faces. And then we also have these particular products that we're talking about today, the community health profiles. And the idea of the community health profiles is a desktop analysis of published evidence and papers that's like a collation of the information. So all the published information that's out there that's reliable, we pull it together and it gives us a snapshot of inequalities faced by particular population groups within Birmingham. We'll move on to the next slide. So everything we do around health and wellbeing in Birmingham is governed by our health and wellbeing strategy. And the idea is that we want Birmingham to become a bolder, healthier city where everybody can have a healthy, happy life. And the community health profiles are there to help us understand some of the gaps or health inequalities in achieving this aim in the different communities across the city. And they describe the health inequalities as a specific community which is bound either by a sense of identity or interest or experience. And the idea is that we help the council and other partners across the city take action to close those gaps and improve health across the city. We're going to publish, well, we have published the community health profiles already. They're there as open access resources to help improve understanding and awareness and help improve evidence-based decision making to close some of the gaps we see between the health and wellbeing between our different communities. And the idea is that we're aiming to refresh them at least every 5 to 8 years, or possibly more often if a whole new data source comes online. So, for example, the census data is about to be updated, and there may be some updates that are required because of that. If we move on. This slide shows us the forward plan for the whole evidence report programme, and the pink box there are community health profiles, and you'll see there's a big list of community health profiles that are in production or have been published already, with today's today's webinar is focusing on the sight loss community health profile in bold there. And you'll see the other topics there of the deep dive reports and the 2 commissions we have running at the moment, one for African and Caribbean health inequalities in Birmingham populations, and also the Poverty Truth Commission. Moving on. So the idea is that the community health profiles don't just look at physical health, but they also look at mental health, as well as health behaviours and the wider determinants of health, the things that give us our life chances and our economic chances, and we know have a huge influence on how healthy we are. And that we collect and present this information under the key headings of the health and wellbeing strategy for Birmingham, the Bolder, Healthier City strategy. And then we go out to engage with local communities on what the evidence is, like what we've managed to pull together, and find the opportunities that are in there to address some of the inequalities that have become apparent. And today's webinar is part of the promotion of the community health profiles, because we really want them to be used. The worst thing that could happen to these is that they sit on a virtual shelf somewhere. We really want people to look at them, use the information in them to help their decision making and design of programmes to tackle the health inequalities. Okay. So the themes within this particular profile, the sight loss profile, you can start at the beginning of life and go right the way through to ageing and dying well. So we're trying to cover the whole life course. And we also have sections looking at green and sustainable future, because we know that the environmental threat and environmental issues are a key determinant of health in the long term. And also looking at mitigating the legacy of COVID-19, which shone such a stark light on the health inequalities in our city. So I'm going to hand over, well, I'll talk a little bit about the methodology, and then I'll hand it back over to Ricky. So the methodology for the community health profiles is that it's a full review of a full literature review looking at academic resources. So we look at formal search methodologies, but we also include not just peer-reviewed literature, but also grey literature, and look at some of the health and wellbeing data and research around some of our health and wellbeing indicators. And then where it's appropriate, we look at comparison groups. So within this particular profile, there are some comparisons between people who have sight loss and people who have sight. So there are some comparisons there. The next slide. Now, because this is a collection of information rather than new information, then sometimes we're a bit limited by what's actually available. If there isn't very much written, we can't make it up. It's just a collection of what's there already. And there was limited data in the 2011 census on disability. And we also know that the population data that we're using is still from the 2011 census. They're only just starting to publish the results of the last 2021 census. So there are some limitations there. So we need to bear those in mind when we're looking at the results. And also there's some limitations in the way that people in the studies that were found in the literature reviews were included within the actual studies. So, for example, we know that people who are born blind or with sight loss might have some different life experiences to those who become blind or lose their sight during their life. And often studies don't separate those two groups. So that's a limitation as well. So when the community health profiles are published, the actual profile, the written document, will be on the website. And there's also a YouTube highlights video and this webinar, and also a set of PowerPoint slides containing a set of infographics, so summary information, which you'll see later on in the presentation today, that we're really hoping people will use moving forward. Okay. So to give you a bit more detail on this particular profile, I'm going to hand over to my colleague, Ricky Bandal, and he'll take us through the next few slides. Over to you, Ricky.
Thank you, Tessa, and really good morning to everybody who's joined us on the link today. I'm a little bit slower today. I ain't feeling 100%. And I'll just give you a bit of background in terms of what the next set of slides are going to look like, and just to what the expectation levels are. So I'm going to be flicking in between a couple of screens in order to do this, and I'll be saying Jordan next slide quite a lot because she's looking after that bit. There are very sensitive topic areas that are covered in the profile. So generically, we kind of say that because people just don't necessarily just click on one profile, they click onto many different profiles. And a lot of this information could be triggering, and we just need to make you aware that there are some support groups and support lines that are available, and we have people online here within the team. If you need to kind of reach out, then please do. Some of the topics that we do cover is around mental health, anxiety, depression, self-harm, stigma. I just need to just double check.
It's not on. I just thought there's no order.
See if I can just put something on mute. Oh yeah, cheers, thanks for that. And so we've got to be very careful around some of the language that's used. So just to be aware that there are some sensitive topics that we will be covering. Okay, the next slide, and let's start into it. So it was Bayswater was our commission provider who wrote this particular profile, and have done a fantastic piece of work from our early feedback that we've come back from. This profile in itself focuses on people with severe sight loss, for who terms blind and partially sighted or low vision are most frequently used. It's important in terms of some of the information that we have found, that we've highlighted it, but it's just as important that some of the areas that we haven't found is also important, because then that allows us to then identify some of the gaps in some of the literature and some of the services out there. Jordan. So according to the RNIB in 2021, there was a report that was done around sight loss data tool. About 1.84 million people are living with sight loss in England, based in 2021 figures. So that's 1 in every 5 people in the UK will have sight loss in their lifetime. Some of the facts that where this is not necessarily at the forefront of some people's thinking, and the way that we've had this as a learning experience within our team and our movement forward, especially during the COVID time when we engaged with the community. It really made a huge difference in our way of thinking and engaging with partners. Jordan. Thank you. So what does the population in Birmingham look like? Again, taken from the RNIB report. So what I'll be doing is looking at some of the bullet points on each of the slides, and just giving you further information around some of the references and the reports that we've gone from. It's very comprehensive. The report in itself is over approximately 100 pages in depth. What we're doing is summarising it in a few slides, bringing it together into an infographic and the YouTube kind of modality, and then be able to share it out with everybody. So again, this is obviously with the census data, which Tessa had mentioned earlier, will be something that would be updated, and our plans for that is to have an updated infographic towards the middle of next year. So I will explain that in the next steps. But in Birmingham, there's approximately 28,600 people living with sight loss. Not only does it with the differentiation, some of the things that from people living with partial sight loss, 6,380 people with partial sight loss, and 18,500 living with mild sight loss as well. Now, according to the World Health Organization in 2019, which did a world report on vision, it highlighted a couple of areas for us, in which we went into a little bit more depth of, which was around the main causes of sight loss. You can see on the graph on the left some of the main sort of variables that have been identified around glaucoma and age-related macular degeneration, and summarized it into two or 3 points within here. So within the South Asian community, there's a higher risk of cataracts. You're 3 times higher a risk of diabetic eye disease in South Asian communities as well, and 4 to 8 times higher risk of glaucoma and diabetic eye disease in Black, African and Caribbean communities. Now, some of this information has also been transferred into our other community health profiles that we've used and shared across. So in an overview of the whole health inequalities that the report identified, came down to 7 areas, which was around lower educational attainment, increased prevalence of clinical depression, difficulties in maintaining healthy diets, less likely to partake in physical activity, limited employment opportunities, which has a real impact in terms of life expectancy. And so it's fairly obvious in terms of with that brings around lower life expectancy, and in later on life, an increased risk of falls in older adults. Now, the themes of the actual profile, as Tessa mentioned earlier, fits our health and wellbeing strategy in 10 sections. So we start off with getting the best start in life, up to and dying well area around protect and detect as well. We did add a section of COVID related information as it's more and more information is coming out. So a report that was taken from key statistics on number of blind and partially sighted children and young people in England in 2013 showed that there was roughly 25,000 children aged between 0 and 16 live with sight loss in the UK, and approximately 550 in Birmingham at that time. 495 children in Birmingham have a statement of special educational needs, abbreviated as SEN. And currently, every primary school in Birmingham aims to offer an eye test for every child during the primary school year, and that was taken from identified in the England and Vision strategy in 2018, where Birmingham Solihull Eye Health and Sight Loss Evidence report came out. So again, we just summarised it into sort of 3 areas. The infographics that come out are actually a little bit better than this, but it's just giving you a bit of information at this point. One of the interesting bits that got pulled out from the RNIB sight loss data tool was that children with visual impairments are more likely to be overweight and obese compared to those without. They may be deprived of opportunities like sports. So this is a kind of an opportunity for us to work with stakeholders and partners, and within our own team around our physical activity and around our food team as well. Also of trying to, if we had to drill down and look into some initiatives or schemes that can happen, it's information like this which is really crucial in terms of moving forward. Thank you, Jordan. So there was sort of main 4 areas that culminated under mental health and well-being, which was adjusting to sight loss, stress, discrimination, isolation, and loneliness. In 2010, Victor and Nyman did a report around emotional support with people with sight loss, and in this paper, it highlighted that only 17% of individuals with sight loss report getting support from clinical or rehabilitation staff with emotional problems. This build-up of stress can have a huge impact on the mental health. So when statistics that came out in another report linked to it around depression and visual impairment trial, it showed that there was between 22 and 38% of people with severe sight loss show signs of clinical depression. Now, another area which I sort of briefly talked about with the other slides was around healthy and affordable food. In obesity, there's high prevalence of obesity with a BMI over 30, so that goes into the obese category. And this is where, amongst those, is where severe visual impairments community will sit in the majority. Healthy eating. There was limited data on this section, so where we do have limited data, especially that's related to Birmingham, we will then look nationally, and then if it is international, we will also highlight it. So under the healthy eating section, it was WHO information that came on a World Report on Vision, and what they said is there was a loads of challenges that made it difficult to sustain a healthy diet, which was highlighted. The other part around accessing services comes from the Birmingham and Solihull health site loss evidence, and they stated within there that Birmingham and Solihull health and sight loss, there needs to be specific provisions for people with severe visual impairments. Whether that's happening at this point, we still haven't had any evidence of that. Next one. So the next area that we're looking into is around active age and ability. So a report that was done in 2015 around the views and experiences of blind and partially sighted people in the UK identified that people with severe sight loss take part in much less physical activity than sighted people. And the main areas that have been identified across the reports were summarised in the 4 sections on your right, around sensory coordination and falls, mobility and transport, lack of confidence, and barriers to communicate. Looking around the employment, which I mentioned earlier, a report that was done in 2009 looked at 1,000 visually impaired people's access to employment, and which was conducted by Birmingham University. It identified that 1 in 5 people with severe sight loss were struggling financially. If we obviously being aware of some of the current financial climate around employment and energy, this is another area that might increase in the near future. Some of the employment states of people who identified themselves with being visually impairment were on long-term or long-term sick or disabled, retired student, unemployment, and employment. If you look at the rates within that report, this was taken again from the sight loss data tool from RNBI. It's pretty evident of the kind of age groups where people are struggling the most. Now, the next few sections are relatively newer in the health and wellbeing strategy that we've put together, which is around protect to detect aging and dying well, and then identifying the gaps, and then finally finishing with mitigating our effects of COVID-19. So, sorry. Within this report, the first one we've got is 50% of this is around early detection. 50% of eyesight problems could be prevented and treated early by detection. This was taken from a 2018 study looking at the economic impact of sight loss and blindness in the UK adult population. The next section that we have again linked to the same report was half of the UK population do not undertake eye tests do not undertake tests every 2 years, which is the recommended guidelines. And then finally, another report that was done in 2012 showed around the barriers and enabling access to primary and secondary eye care, identified that 1 in 40 GP consultations are concerning eyesight. That was followed up by another report that was looked in 2017 around better health access for people with visual impairment. Identified NHS England audit of 18 GPs in Birmingham found that barriers to access are physical, communicational, procedural, medical, and behavioural. Aging and dying well. The 4 areas at the bottom summarised some of the main challenges that we're facing around diabetes being a risk factor for blindness. Over 65s are more likely to experience falls. 60% of people who have strokes experience visual impairment, and over 75s have higher incidence of depressive symptoms. Deloitte did a study in 2014 around some of the things that identified, and it stated within there that sight loss increases with age. 1 in 8 people over 60 have sight loss, and this rises to 1 in 2 in those aged over 90. Jordan. So the next couple of slides, I'm actually going to kind of glance through, because I'm obviously aware that I'm giving quite a lot of information in this, and closing the gaps actually comes into the next section where we're looking at next steps. But in summary on this bit, it was just saying around kind of the health inequalities, which is what we've identified within here, summarizing like lower attendance and attainment education, experiences of isolation and loneliness, mobility problems when leaving, and higher employment and increased financial difficulties. So I'm just going to go to show the next slide, and then we'll be able to look at the infographics that we've produced. Now, this is an area that is developing, and it is with all the sort of studies coming out post-pandemic. A lot of the information came out from RNIB 2021 report, which was Voice of the Customer, and summarise it saying people with sight loss found that the lockdown periods increased loneliness, negatively affected their mental health and further inhibited social life. I mean, this area is going to develop really quickly. So when we do the update in the near future, this section will be a lot more, we'll have a lot more detail around that. And some of the census data, again, as I mentioned at the beginning of the presentation, will have a slight adverse effect on a couple of just sections, but 95% of the report itself should stay relatively the same. So again, a lot of information being said, and what we try to do is to kind of summarize it into sections based on the health and wellbeing strategy. So what we're going to do is we're going to go on to the next slide, and it's an infographic. What this allows you to do, these sets of infographics, is that if ever you're doing reports or anything that you want to utilize, these are really good statistics, really good headlines that can show the challenges that we face around it. So the first slide that we have is just giving a context view internationally, and then looking at it, drilling down into sort of the more Birmingham data. To look at the context of each of these studies, it is reported in the bigger report. This is just a way of summarizing it in an infographic format. Jordan? So here we got the start of the theme started kicking in terms of columns around mental health and wellness, wider determinants, active at every age and ability, and aging and dying well. So if we look at, sorry, just one more, Jordan, if you just go back. So for example, we know that there might be changes, especially if you look at aging and dying well, on the top right, that 30% of the population age 65 and are 65 and over. However, 70% of those who are blind or partially sighted are over the age of 65. Now, if we have an older population when the census data comes out, we know that's going to likely to increase. Next one, Jordan. We've got two more that we've done. So getting the best start in life, working and learning well, protect and detect. And the last one is looking at life expectancy, inequality and gaps in services and provision. Okay, so this looks really great and the infographics look great, but what are we looking and likely to be doing in our next steps? What we've done is we have a set of community health profiles, which is 16 plus. We've done 16 different profiles, and we're going to be doing another roughly 11 or 12 in this year, either commissioned out or done internally. What we're looking to do is we've gone out to tender, we've gone out to work with providers, and looking at to identify some of the health inequalities that have been highlighted in here, and ask them to come up with an initiative or a scheme or something like that in order to try and tackle that health inequality. Now, we understand these are decades of health inequalities that have turned up over the years. We're not going to be able to change something in overnight. However, what we are able to do with our experiences building these community health intelligence is to work with partners and work with the community to see what kind of changes that we can make as well. This is an area that my team who are here, who've been fantastic in pulling this all together, are really keen to make those links as well. But what will be the biggest benefit is that people in this room are able to look at this profile and other profiles that we've done and really utilize some of the data that's within there, because this hasn't been done before. It's been a learning experience as we've been delivering and bringing these together. And so your feedback will be really, really important as we progress forward. Tessa?
Thank you. So if anybody's got any questions or anything they really want to raise urgently, feel free to put it in the chat. But for the immediate, we're going to just move on to using Menti and ask you some questions. So I'm hoping that everyone's got Menti loaded up on their phones now. You'll see here, if you haven't got the app already, you can scan the QR code to get to it, or you can just search menti.com. And then you need to put the code in 56986071. And if we move on to the first question. So you'll see the questions come up on your phone as well, if you've got it loaded. And if you're in a hurry and you're going to struggle to stay to the end of the session today, you can actually skip forward and answer the questions in advance. But it works well if we do them all together so that we can see them on the screen as we go. So let's move on to the first question, shall we, Jordan? Sorry. Okay, so first of all, people are already answering. That's brilliant. Okay, so how are we feeling today? Let's get a bit of a mood kind of measure here. So people feeling really energized Monday morning, or are you still feeling a bit low mood because we've come back to work after the weekend? Brilliant. Okay, so we're settling around 5.9. So people are a bit gloomy this morning. It must be the weather. Friday afternoon, everyone was a bit more chirpy in the one we did on Friday, but 5.9 is okay. All right, let's move on to the next question. So we're going to ask some questions about you now. If you don't feel that you want to answer them, there's no pressure. But if you do want to answer them, that would really help us. So let's move on to the next one. So let's have a look and see how old we all are. And this helps us know if there are particular age groups that we need to target with more information about the community health profiles, people that we're really missing. And we've got quite a good spread there, haven't we, of people of working age. Maybe missing some of our younger working age people, but most people there working age, which is what you'd expect. So that's great, thank you. Let's move on. So how would you define your ethnicity? Lots of white British people here today. One black African, so that's good. Welsh person. Brilliant. Okay, thank you. Let's move on to religion. How would you describe your religion? That's great. Thank you, everybody, for sharing. That's great. And let's move on to the next question. So do you consider yourself to have a disability? Okay, that's interesting because when we've done our previous community health profile webinars, we've had similar proportions of people who would consider themselves to have a disability or not. And the other community health profiles have been about populations of identity. So a different group from the groups that we're looking at today. That's great. Thank you for sharing. Let's move on. And where do you come from? What's the first part of your postcode? Give us an idea about the reach of people that are coming along to our webinars. So we're not going to show this one on the screen, but I can see how many people, 14 people have put their postcodes in, which I really appreciate. Brilliant. So some ideas now on how you and your organisation might cascade this information into the sight loss community and with key stakeholders. Because as we said, we really want this information to help people with their decision making. So if you're writing a bid for money, if you're writing a project up or designing a new intervention, a new programme, that's the sort of thing that we think this would be useful for. But we're really interested to see what you think about how you might cascade that information in the community health profiles down into your communities with key stakeholders. It's got some really good ideas there already. Any others that you can think of? Be great to have up there. Yes, it's really great because, as we said earlier on, the last thing we want is for these profiles to sit on a virtual shelf somewhere and no one ever read them. There's lots of power in the information in here. Be great to see it used. That's great. So some real variety there, isn't there? Looking at how people are using it to inform conversations that they have with their stakeholders and also informing research as well, and looking at gap analyses. So some really good ideas there. Thank you. So what opportunities will you have to embed the key findings in your line of work?
Yeah. Nice.
Yeah, some good ideas there through corporate comms and through the organisation into the ICS, team meetings and through management type work, community funding, community activities. Comms are getting a lot of billing here. So any opportunities that you have as individuals to embed the key findings in the community health profile into your line of work. Okay, let's move on. So now you get to rank some of the issues that have come out from the community health profile to see which ones you think are the most important for the sight loss community to focus on. So you can put in the one that you think is the top priority and we'll see how they move around. So at the moment we've got the blue one is fewer opportunities to become self-sufficient or independent through education, employment and financial security, higher levels of mental health problems, increased isolation and loneliness, particularly with older people, difficulty in accessing healthcare, low levels of physical activity and difficulty following a healthy diet. So difficulty maintaining healthy behaviours. They're jumping around a bit here. That's good as people put their ideas in. Any last minute additions? Seems to have slowed down a bit. Okay, so interesting. The first one is around those opportunities to become self-sufficient and independent, and quite a kind of key winner there in terms of the priorities. And again, underlines those wider determinants of health, doesn't it? That we know that the more opportunity you have to control your life, the better it is for your overall health and well-being. So that blue one, quite a clear winner there. And then sort of second and third pretty joint around mental health and accessing healthcare, and actually fourth pretty much the same as well about isolation and loneliness, and the health behaviours coming in at number 5. Yeah, so thank you for voting on those. That's really useful to know. Okay, let's move on. So we've talked a little bit about this is the beginning of the journey of engagement around the sight loss profile. What should our future engagement around the sight loss profile look like? Really interested to hear your ideas. It's nice to see that people think that this is a tool for co-production. Really important. Any ideas on what future engagement should look like around the sight loss profile? How can we get people really enthused about this and listen to what their views are on it? Okay, that's great. Thank you. We'll move on. And how will we measure the success of this profile? How will we know if it's been a useful thing to do? What would success look like? determinants. That's useful, isn't it? So we'll know if it's been useful if it informs successful bids and if it makes a difference to provision of services for people with sight loss, and that those communities feel like there's more opportunities available to them. And then there's another theme coming out about sharing with communities and working together. So if we'll know if it's been a success if that happens. Yeah, and feedback from, yes, and the awareness. Yeah, useful stuff. That's really helpful. Thank you. And are there any other formats that you think we should be putting the profile and the information into to increase accessibility? So we've mentioned before that we've got the written document and the slide deck, and then we've also got the webinar and a YouTube video. Is there anything else that we should be doing to increase accessibility? I don't know if that's Menti that's frozen or if people have run out of ideas. Oh, here we go. Yes. Yeah, that's very true. We should be asking the community that, shouldn't we? Yes. Yeah. Yes, those physical sessions are important, aren't they? Because then you can clarify and rectify any kind of misunderstandings immediately. We do need to ask people with sight loss. You're absolutely right. It's a really good point. We're asking everybody, so we're interested to see what you think as well. Okay, that's really helpful. Thank you. Right, so after the workshop, how are you feeling now in terms of mood? Well, 5 people are feeling better. See how everybody else is feeling. Brilliant. Okay, so we've got most of the people who have been responding have responded, and we've hopefully helped you feel a little bit more energized and enthused and interested about our community health profiles and about your Monday morning, because your level of energy has increased in the last half an hour, so that's good. So 7.5 we're up at the moment, which isn't bad for a Monday morning, is it? Brilliant, thank you. Okay, so Ricky, do you want to step us through the next steps?
Yeah, so just earlier just went through around that the engagement partners will be kind of working with the community and with various profiles. We're still at that kind of stage, so some are more advanced where we've got a named partner, some we're still, the opportunities are still available as well at this time. So what we've got is another kind of another set of engagement webinars for our profiles, which are coming up. One which is actually in a short while. We've already done Somali, Kenyan, and Nigerian profiles. Lesbian and trans community. We've obviously just done the sight loss, and we've got the deaf and hearing loss one coming up at 11 a.m. And then we have a Caribbean Commonwealth one coming up tomorrow. We do have a couple more going to be scheduled in October. We're just trying to find out dates, and we're looking to have Justin available on those ones as well, our director. This presentation will be available. We'll be putting it on our website as well, and we've done a specialised references as well, which I've used within this presentation. Any questions, or do we bring it to a close?
If anybody's got any urgent questions, then they can pop them in the chat.
Thank you, Val.
Yes, poor Ricky. He's doing well this morning. Okay, so I'm not seeing any urgent questions pop up in the chat, so I'm going to draw us to a close and thank everybody. Thank everyone for their contributions this morning. To Ricky for presenting, Jordan for changing the slides, and the rest of the team for all the work they've done behind the scenes to get these webinars up and running. And most of all, thank you to you for giving up an hour on your Monday morning to listen to the presentation. Really hope you're going to find this community health profile of use in your work, and really looking forward to getting your feedback so that we can continue to improve them and make them even more useful for people to tackle the inequalities that we see across Birmingham. So thank you very much for your time. We'll close the session there. Bye now.
Thank you. Bye.
You're right, Tessa.
Yeah, good.
Yeah.
Really good.
That was all right, wasn't it?
Yeah, I think it went quite well. Yeah, it's good. So it's better.
Sorry,
just
the meeting is still being recorded.
Oh, okay, thank you. You can chop off that last bit.
Yeah.
Well, we stay.